Hi everybody, welcome to another one of our Inova Live Health Chats. Today we're going to talk about coping with allergies, relief for sufferers of all ages. My name is Dr. Miriam S. I'm a primary care physician, board certified in both internal medicine and pediatrics here at our Inova Medical Group Gainesville location. Alright, so let's get started. So the first thing I wanted to mention is today I'm going to talk about seasonal or environmental allergies. I'm not going to talk about food allergies or medication allergies as much. That's kind of out of the scope of this talk and better left for another time. So I'm going to talk more about the seasonal allergies. So seasonal allergies are very common. It affects 10 to 30% of Americans. So what are seasonal or environmental allergies? The main allergic symptom you get is called allergic rhinitis. And that word rhinitis basically comes from rhino, meaning nose, and itis, meaning inflammation. So you have inflammation right here in the nose and sinus area that causes those symptoms of the allergies. Can also have allergic conjunctivitis, and that is inflammation in the conjunctiva of the eye. So it basically causes allergic pink eye. And then you can have sinusitis, so inflammation of the sinuses, both here and in the forehead. And so allergies can affect all three areas. So where does it come from? What causes the allergies to begin with? So it all stems from a histamine reaction. Histamine is part of the body's immune system. And basically, the body recognizes something foreign to the body and is trying to get rid of it. So it releases histamine in a way to try and get rid of that substance. So this causes all the symptoms that can happen with allergies. So I think of it as the body trying to flush out that foreign substance. So sneezing is a big one, trying to get it out of the nose. Watery eyes, runny nose, it's all trying to produce fluid to flush out the system. So there are indoor triggers that can cause allergic responses in the histamine reaction, and these are things like dust, mold, pet dander. And then there are outdoor triggers, things like pollen, trees, grass. So the symptoms you get are basically a result of the buildup of this fluid from the histamine reaction. So you get a runny nose, a stuffy nose, itchy, watery eyes, congestion, postnasal dripping down the back of the throat from that fluid. That can cause a sore throat, can cause a cough with phlegm formation, feeling like you have to clear your throat a lot. The ear, nose, and throat are all connected, so you can also have fluid that builds up in the ears, and that can cause pressure and pain. You can have sinus pressure in here because the fluid builds up in the sinuses. And then because your immune system, the histamine reaction is going through your whole body, you can really feel fatigued and feel like it's really knocking the wind out of you. So there are some other conditions that are associated with allergies. It isn't just the nose and the sinus, like I mentioned. It can involve the eyes, the conjunctivitis that I mentioned. And then there's something called the allergic triad, and these are asthma, eczema, and allergies. And so the three of them are very closely related, and someone who has one is at higher risk of having another. And then sinusitis, inflammation of the sinuses. So what are some risk factors for the development of allergies? The biggest one is a family history of one of those things in the allergic triad. So a family history of allergies, eczema, or asthma, or a combination of the three. Really puts you at a higher risk of developing allergies. And then there are some other factors that could put you at risk. They found that male sex, being male, puts you at higher risk. Being born during the pollen season, being a firstborn child, early use of antibiotics in childhood. If you were exposed to, if your mother exposed you to smoking in the first year of life, if your mom was smoking in your first year of life and you were exposed to smoking, it puts you at higher risk for allergies. And then exposure to indoor allergens such as dust mites. So then how do you really develop allergies? To develop them, you usually have to be exposed to that trigger, the allergen, over a period of time, which is usually years. So it's really unusual for kids under 2 to develop allergies because they just haven't been exposed to it long enough. So if you're thinking that your child under 2 may have allergies, it's really something that you need to look into with your doctor to see if there's anything else that could be causing those symptoms. So there are 2 times during life that you really see people develop allergies. The first one is during childhood, so preschool, school-age kids. You really can see them develop the allergies. And then in early adulthood. It would be unusual to develop allergies later in life, 40s, 50s, unless something has changed and you are exposed to something that you weren't previously exposed to before. So if you got a new pet that you never had before, or if you move to a new climate. So I see that all the time. People who live in Texas or Florida, they move here to Virginia and all of a sudden they have allergies and they never had them before. So those are the 2 times you may see it develop in adulthood, but otherwise you really don't see people developing it later in life. So how do I diagnose allergies in you or your family? So the first thing is history. So I listen to the story of what's been going on. The biggest thing I look for is fever. One of the things that could be hard to tell is if it's allergies or a cold. So fever really can point you more towards it being from a cold as opposed to allergies. With allergies, you really don't get a fever. Also with allergies, it tends to be a slower onset of symptoms, so it comes on gradually, as opposed to a cold where the symptoms may come on all of a sudden. Also, if there have been similar symptoms in the past, especially when exposed to something similar to now, like if it's the same season or if it's cats, been around cats, every time you're around cats you get these symptoms, so that can definitely cause it. Then I do a physical exam, so I take a look at you, and I'll touch on that in a couple minutes. Sometimes I'll do a trial of treatment and see if the treatment helps, because a lot of times that can help in making the diagnosis as well. And then there's allergy testing, so if all of that doesn't work and we're still not sure what's going on, then there's skin and blood testing that can be done. And I'll talk about a little more about that in a few minutes too. So what do I look for when I do my physical exam on you? The first thing is dark circles under the eyes. So these are called allergic shiners, and you can definitely mainly see these in kids. You can see them in adults too, but kids are really unlikely to have dark circles under their eyes anyway, so it can be really noticeable. So that's definitely a sign of allergies. Another one is lines that form under the eyes, like right here. This can be from the inflammation from the allergic pink eye. That can happen. One of the big things that I can see is a crease develop on the nose right here. This is from what they call the allergic salute, which is basically this motion. And because people have the sneezing and itchy nose, they do this motion a lot. And so that causes a crease to develop right here on the nose over time. So that can definitely be a sign of chronic uncontrolled allergies. I look inside the nose. I can see clear fluid, and sometimes I see so much swelling on the inside of the nose that it looks like the nostril is almost completely obstructed. So that can cause a lot of discomfort and congestion. If I look in the ears, I can see the clear fluid behind the eardrums sometimes. And then if I look in the back of the throat, I can sometimes even see the dripping, or I can see it a little red because it looks a little irritated from all the dripping back there. I may hear a wet cough, again from all the dripping triggering a cough. And there can be some sinus tenderness. So if I push right here on the sinuses, sometimes it's a little uncomfortable from the fluid buildup there. So and then I look for the absence of things like fever and other signs that may look like there's an infection going on. And then treatment. So sometimes we'll do a trial of treatment like I mentioned. And if it really looks like it's typical allergies, then I definitely initiate treatment right away. The biggest thing is you really want to minimize your exposure to the triggers. So if you're having outdoor allergies, pollens, trees, grass. The biggest thing is to keep your windows closed. Windows in your house and in your car, you really want to keep them closed so that those allergy triggers don't come inside the house to cause persistent exposure to those triggers. You also want to avoid going outside when the pollen count is high. So looking at the weather report and seeing if the weather count is high can really help avoid really setting off those allergies. If you have indoor triggers, so things like pets, so if you know that you're allergic to cats, then you may want to avoid having a cat at home. Sometimes I know that's not possible, so if you can, you want to keep the cat out of your bedroom so that they're not on your bed, your sheets, your pillows, so that you're not closely exposed to those triggers. Also, dust mites. Those are a big trigger for a lot of people, an indoor trigger. Dust mites are basically little insects that don't cause any problems other than triggering allergies. So the way you minimize being exposed to them, the biggest thing is they like to live in increased humid areas and in soft things that can really trap the dust mites in. So things like carpet, your pillows, your mattress, sheets, blankets, things like that. So the first thing to do is to protect your mattress and your pillows. They make covers that can protect them so that the dust mites can't get in there. And then you want to wash your sheets and blankets frequently, at least once a week, in hot water and on high setting in the dryer. That can really help minimize your exposure to those dust mites. Also, if you can avoid having carpet in your house, you would try to do that as much as possible because it can really get trapped in there. If you have to have carpet, then you want to vacuum frequently with a vacuum that has a HEPA filter in it to keep those dust mites from circulating back through the air. And then you also, for kids, you want to avoid having a lot of stuffed animals in their bedroom because, again, that traps it in there and you don't usually wash them frequently, so that can really expose them to those triggers. So then medication treatment. What's the first step with medication? There are two big categories to suppress the overall histamine response. And if you suppress the histamine response, that's what's going on, what's causing all the problems in the first place. That's the best way to treat the symptoms. And there are two big medications that can do that. One is the oral antihistamine. These are things like Claritin, Zyrtec, Allegra. Benadryl is also an antihistamine. Or a nasal steroid spray. Those are anti-inflammatories and work right at the source of the problem, which is in the nose and the sinuses. So initially, antihistamines, Claritin, Zyrtec, Allegra, they have been the main treatment, the first-line treatment for allergies. But more recently, they found that the nose sprays tend to be a better treatment alone. So antihistamines work a little better in working with the nose spray, but sometimes the nose spray alone can really help symptoms. So first, the antihistamine. I prefer the ones that you take daily, so Claritin, Zyrtec, or Allegra, as opposed to Benadryl. Benadryl can help for a short time decrease the histamine response, but doesn't really help to control it over long periods of time. So if you need a quick relief, then Benadryl might be helpful, but to really treat the underlying problem, those daily medications like Claritin, Zyrtec, or Allegra are much better. I don't find that one works a whole lot better than another. Some patients find that they prefer one over another, but I don't find that there's one that consistently works better than another. So I usually say try what you have at home or what's on sale at the drugstore. It's also important to note that one dose may not help your symptoms, especially if they've been going on for weeks or months. It may take continued use to really be able to overall suppress that histamine reaction. So I usually say if your symptoms have been going on for 3 or 4 weeks, it might take 2 to 3 weeks for the antihistamine to work. So give it a good shot by taking it every day for a few weeks. And then there's the nasal steroids. So it's a spray. These are things like Flonase, Nasonex, Nasacort. Nasacort did just get approved for over-the-counter use, so you can buy that over-the-counter at the drugstore. Flonase and Nasonex are still prescription. These work really well because they work at the source of the problem, which is in the nose and the sinus. It's an anti-inflammatory. It stays local. It doesn't get absorbed to your whole system as much as taking a pill by mouth. So these are the preferred first-line medications for kids and for pregnant women. Some people may feel like a nose spray may be uncomfortable. If you angle it to the sides as opposed to straight up, it doesn't feel as much like you have water in your nose, so it's a little less uncomfortable. You also don't want to completely inhale it when you use the spray, because then you just end up swallowing it and it doesn't work where it needs to. So you may feel like you have to sniffle a little bit because it might feel like it's dripping out, but you really don't want to inhale it. But they're really finding that this works, this alone is working well on its own, as opposed to the antihistamines by themselves. But I find that the two together really work the best. So then there are some other symptom relievers that you can do in the meantime until these things start to kick in. These don't suppress the histamine reaction. These really just help some of your symptoms for a short time, which can be helpful when symptoms are really bad. So the first one is a sinus rinse. So basically you're rinsing out your sinuses from all the congestion that's there, and a lot of people find relief with that. These are things like neti pot or sinus rinse. They're also available over the counter. They come as little packets of salt mixtures, and you mix it with filtered water, and then you basically pour it in one nostril. It flushes through your sinuses and comes out the other nostril. Again, some people feel like that sounds really uncomfortable, but if you follow their directions and hold your head at a certain angle, it really feels good, like you're relieving all the junk that's in there and feeling like you're flushing everything out. So a lot of people find relief with it. If you are using the nose spray, you do want to do the rinse before using the spray so you're not flushing it out. And then you only want to do that maybe once or twice a day. Any more frequent can cause further inflammation and cause further problems down the line. So once or twice a day, though, works pretty well. And then there are decongestants that you can take. These are things like pseudoephedrine, which is the main ingredient in Sudafed, or Allegra D. The D part in Allegra D, Claritin D, Mucinex D, has the pseudoephedrine medication. And this is a decongestant that works pretty quickly, so it can help dry up the mucus that's in there and in the ears and the dripping to bring some immediate relief. You do want to avoid these types of cold and cough medicines in children under 6. They have found that there's more side effects in these kids than really been found to have benefit. So really avoid any cold and cough medicine in kids under 6. And then if you have high blood pressure, you also want to avoid this type of medication because it can elevate your blood pressure. If you have the conjunctivitis, the itchy eyes from the allergies, they do make allergy eye drops. So these Visine A is one option. Zadidor, Z-A-D-I-T-O-R, is another eye drop that used to be prescription and now is available over the counter. This one is every 12 hours as opposed to the Visine A, which you have to use a little more frequently. So those are both two good options for if you're having the itchy, watery eyes. If neither of those works, there are some prescription versions available. For those with asthma, there's another allergy medicine called Singular that could also be helpful. And then if all of these things don't work and you feel like your symptoms aren't controlled, that's when it's probably best to see an allergist, and they can do allergy testing, see exactly what you're allergic to, and then you can have allergy shots. Basically what those are is exposing your body to tiny amounts of your trigger to get your body used to it over time. And so then you won't have that histamine reaction because your body is not recognizing it as foreign anymore. So traditionally, these have come in allergy shots. Now the FDA has just approved a few oral versions. So if this is something you would like to consider, then I would definitely talk to an allergist about that. So what happens if over time you have chronic allergies and they're not really being treated? Well, over time you can find that the more you're exposed to it, the worse your symptoms get. It can lead to chronic inflammation and polyps. So polyps are basically little swellings in the mucous membranes that can cause obstruction and further complications. Sometimes you have to see an ear, nose, and throat doctor, just because there's been inflammation for so long that everything is really inflamed and swollen. Also, they've found that over time, people with allergies become more sensitive to certain chemicals in the air. So things like tobacco smoke, they may not have really found that it irritated them in the past, but over time they find that they're really sensitive to it. Other things are pollution, so going to an inner city may be irritating to the allergies, and then strong scents like perfume. Some people really can't handle those types of smells. Also, whenever there's fluid that's sitting around, it's at risk for infection. So if you have fluid in your ear and not able to drain, then because it's sitting there, it can get infected, and that's when an ear infection could develop for both adults and kids. Also sinus infection, so if the fluid is sitting in there, it's at risk for infection, and antibiotics may be necessary in that case. Usually you have fever, worsening pain, and significant worsening of all your symptoms. Also, if there's chronic fluid in the ear that's causing pressure, difficulty hearing, things like that, sometimes you need to have tubes to allow that fluid to drain. And this can happen for adults and kids. Typically, we think of tubes in the ears as something that kids get from having chronic ear infections, but there are a lot of adults that need it too. All right, so now I think we're going to take some of your questions live. Let's see. So the first one, can children who have severe allergies take adult doses of medication? So that's a really good question. Sometimes, so the answer is sometimes, so you have to be really careful about this because all the different medications are different for the different ages. So Claritin's dosing is different than Zyrtec's dosing, is different than Allegra's dosing. So you really want to double check. For instance, Claritin's dosing for 6 and above is the adult dosing. It's 10 milligrams. From 2 to 5 years old, it's half that. It's 5 milligrams. Zyrtec has different dosing for multiple different age groups. And then Allegra's dosing is for less than 12 and above 12. So it's all different. So you really want to make sure you're giving your child the children's version, and that's based on their weight. If you have any questions about dosing of medication, then you absolutely should confirm with your primary care doctor before giving it to them. And if you're a patient of Inova Medical Group, we do always have a physician on call available at night and on weekends that you can always call if you have a question about dosing to confirm your dosing. And for the nose sprays are the same dosing for adults and kids, so that should be okay, but I still wouldn't start a new medication on the kid without talking to your pediatrician first or your family doctor. All right, next question. How can you tell if you have allergies or if your symptoms are a cold or other virus? So that's a really good question. Sometimes it's really hard to tell because a lot of the symptoms overlap. The runny, stuffy nose, the congestion, the ear pain, the sore throat, the coughing, all can be from allergies or from a cold. The big thing that I look for is fever. If you have a fever, it's most likely an infection. Also, if your symptoms happened all of a sudden, you're more likely to have a cold rather than allergies. If you have a history of allergies and these symptoms are similar to your allergy symptoms in the past, then maybe it's allergies. Also, if you had a sick contact, so especially for kids in preschool or they just started daycare, they're exposed to new germs. A lot of times it's from a cold as opposed to allergies. So for allergies, I look for a pattern over time. Viruses usually get better pretty quickly too, within 5 to 7 days or so. So yeah. All right. Can children take a nasal allergy spray along with oral medicine for allergies? So absolutely. It's probably the best treatment. For children, I tend to start a little more with the nose spray first. and I see if that works by itself. So a lot of times that works by itself, but sometimes it's hard to get kids to take the nose spray depending on their age. So I will use the oral antihistamines like Claritin or Zyrtec, and then also use the spray as much as possible. So you definitely can take those two together. They don't interact. They work really well together. So absolutely. And then what allergy medicines are best to combine? So I definitely like the antihistamines, so Claritin, Zyrtec, Allegra, and the nose spray. So the two, like I said, they don't interact at all. They work well together. So one decreases the histamine reaction. The other one is a direct anti-inflammatory to the problem areas. So the two work really well together. Some people take doses of Benadryl here and there because they need more immediate relief, and so that can be helpful. It can be sedating. It can make you sleepy, so I tend to recommend that if the symptoms are really bad at night, right before bed, so that might be helpful. For kids, I try and avoid the use of Benadryl, again, because it makes them sleepy for the most part, but there are a lot of kids that may react the opposite to Benadryl. It might make them really awake and wired, so I try to avoid that as much as possible and tend to stick with the nose spray and the oral antihistamines. At what age should a child be tested for allergies? So there's no real set age that they should be tested. Like I mentioned before, it would be unusual for a kid that's under 2 years old to have allergies. So if that's really what we think is going on, then they probably should see a specialist and consider having testing for allergies and see if there could be something else that could be causing it. Then I really send them for testing if the symptoms get to be really persistent. Some people, they have the symptoms all year round, so they may consider going in for allergy shots to get their body used to it so that they don't have those reactions anymore. So if we're thinking that that might be an option, or if we're looking to see exactly what they're allergic to so we can try and avoid that thing, then I'll send them for allergy testing. And how do you know if you're a candidate for allergy shots? So it's mainly if you continue to have symptoms in addition to trying all those treatments that I mentioned before. So if you have persistent symptoms, the antihistamine, the nose spray, the nasal wash, the eye drops, all of that doesn't work, then I might consider you for allergy shots. You do have to go for testing first. There's skin and blood testing. Skin tends to be the better testing, and they basically expose your skin to a little bit of the allergen, and then they see if your skin reacts to it. And then if they can find one particular thing that you're allergic to, then they may consider you for allergy testing or allergy shots. So if you're considering that, I would schedule an appointment with an allergist for sure. All right, looks like that's all we have time for. So in summary, allergies are really common and they affect up to 1/3 of our population. They're the body's response to an allergen, a trigger that the body feels is foreign. And symptoms include stuffy, runny nose, itchy, watery eyes, ear pain and pressure, sore throat, phlegm, cough, in the absence of fever. And then treatment includes avoiding exposure to your trigger, oral antihistamines, nasal steroids, nasal washes, eye drops, and allergy shots. If you have any questions, call your primary care doctor or consider seeing an allergist. And if you'd like to make an appointment or learn more about Inova Medical Group and a location near you, please visit our website at www.inovamedicalgroup.org. Thanks, guys. See you soon.